Case selection. Choosing the proper case, especially when you're first starting out, is crucial. If you have not used any prefabricated crowns of this type, we recommend choosing cases with plenty of space between teeth and cases with adequate vertical space. Cases that would not be good candidates would be cases with crowding in the anterior and heavy bruxers. Preparation. Preparation is very similar to the preparation for plain stainless steel crowns, with a little extra tooth reduction. It is best to approximate the size of the patient's tooth before prepping it. Typically, you may find that a crown one size smaller will work best for some cases. Our experience tells us you will need an extra 15 to 20% tooth reduction. Some dentists use slightly larger burrs than with a plain stainless steel crown. The most important key to remember is that a passive fit is required. Important: a passive fit with slight finger pressure using a good cement will give the best results with kinder crowns. The crowns that snap to place, as most dentists are accustomed to, may create excessive pressure on the composite facing. With modern cements, you will rely on the properties of the cement to retain the crown with excellent results. Any carbides or diamonds can be used for preparation. We've put together a prep kit in an autoclavable burr block to help in burr selection. Initial preparation is most commonly done with a 330 carbide or 855 tapered diamond, depending on preference. Remove the mesial and distal, working around to the facial. A football or flame-shaped diamond such as a 368 is most commonly used for the lingual preparation. This burr can also create a nice knife edge margin, which we recommend. You can then use a fine diamond if desired to smooth out the prep, although this step is often not necessary. If you need to do a pulpal therapy, do it at this time. Fitting. Probably the most important part of using kinder crowns is selecting the right size crown. The facial has been pre-crimped before applying the facing, and it cannot be re-crimped. We recommend that you use a regular set of stainless steel crowns to choose the correct size and for tooth reduction guides. This will give you an approximation of reduction needed and will help eliminate stress from flexing of the composite facing. Stainless steel crowns are also easily disinfected. You should shape the one you will be using for sizing to approximate the crimp we've made. If you would like to order a set of unfaced stainless steel crowns for fitting, please contact us. We recommend using a cold disinfectant solution, such as glutaraldehyde, or a phenol base to soak the kinder crowns for disinfecting. We recommend staying away from iodophores or iodine-based disinfectants because of a possible staining effect. Repeated autoclaving may discolor the facing and have potential adverse effects on the bond of the facing. Shortening. While fitting the crowns, you may find that you need to shorten them. This is not a problem. However, if you find that you have to shorten all your crowns, we can save you a lot of time and headaches. We offer our crowns pre-shortened by 1 millimeter. This will also save wear and tear on the composite interface. Do not use a scissors to shorten these crowns. If you need to shorten a crown, you may use one of the following techniques. You may shorten the crown by using a sandpaper disc, fine diamond, slow speed, soft stone, green or white, or a coarse rubber wheel. You should grind horizontal to the composite metal junction. As with all composites, carbides should be avoided, as they can set up fracture lines. If you shorten the facial, you will lose the facial crimp, so you may have to compensate on the lingual crimp. After shortening, you may also feather the composite at the margin if needed, and polish as you would any other composite. Crimping. If you would like to crimp the lingual to fit, stay away from the composite metal junction at the interproximal. Before applying the composite, we squeeze the crowns mesial distally to round them out and to make them less ovoid. We also crimp the facial before the composite is applied. The crowns cannot be squeezed mesial distally, or you could create a fracture line. When crimping, keep in mind that you want a passive fit. Placement and cementation. Use light finger pressure when putting the crowns to place. Excess force may cause a crack or weaken the interface, creating a future problem. Whatever you use to cement regular stainless steel crowns can be used to cement Kinder crowns. The cement of choice by the majority of dentists is resin-modified glass ionomer, although straight glass ionomer is certainly adequate. The fluid nature of glass ionomer also helps avoid air bubbles. If you are using a liquid powder glass ionomer, we recommend a thicker mix which is stronger and will also keep the crowns from slipping down while seating multiple unit cases. After cementation, do not disturb the crown until the cement has reached its final set. Clean up the excess cement following the manufacturer's recommendations. Unless specified, when you place your order, Kinder crowns are contoured universal, or in other words, can be used as either a left or right. This helps you by minimizing the inventory of crowns you need to keep on hand. Once the crown is cemented in place, you may round off the distal corner to blend in more aesthetically. This step is an optional step, and you will find that some cases will require it while others will not. After rounding the distal corner, polish the composite with your normal composite finishing procedure. Please note that we can contour your crowns as lefts or rights if you desire. Just let us know when you place your order.